Hello and welcome to your program of choice, Health Affair on AIT. It is a platform where we focus on public health issues, challenges of women and children, with a view to providing lasting solutions. I am your regular anchor, Oshuomuowa Danes. Our focus this week is on food safety. Let's begin with the news segment.
The World Health Organization has been informed of a confirmed case of monkeypox in an individual who traveled from the United Kingdom to Nigeria. The case was immediately isolated and contact tracing was performed. However, as the source of infection in Nigeria is not known, there remains a risk of ongoing transmission. Monkeypox is a sylvatic zoonosis with incidental human infections that occur sporadically in forested parts of Central and West Africa. The symptoms can be mild or severe, and lesions can be very itchy or painful. The animal reservoir remains unknown, although is likely to be among rodents. Contact with live and dead animals through hunting and consumption of wild game or bushmeat are known risk factors. President Muhammadu Buhari has signed into law the recently passed National Health Insurance Authority Bill 2022. At the signing of the new law, President Buhari said that a fund will be set up to ensure coverage of 83 million poor Nigerians who cannot afford to pay premiums as recommended by the Lancet Nigeria Commission. On how the fund will be sourced for the large number of vulnerable individuals who are not able to pay health insurance premiums, he said the Vulnerable Group Fund will be set up to include a component of the Basic Healthcare Provision Fund due to the authority, health insurance levy, special intervention fund, and any investment proceeds, donations and gifts will be to the authority. The president, in a statement issued by his senior special assistant on media and publicity, Garba Shehu, announced that the authority will collaborate with state government health insurance schemes to accredit primary and secondary health facilities and enroll Nigerians into the scheme in order to ensure the delivery of quality health care. The new act also enables the authority and state governments to develop information management systems and digital records for better data collection, monitoring, and quality assurance. The President tasked the Health Reform Committee to work with state governments, the Federal Ministry of Health, and the National Health Insurance Authority to ensure the implementation of the articles in the new act.
Community is already driving towards renewable, cleaner energy with a set target of 2030 for zero carbon emission. These protesters who marched to the Lagos head office of one of the multinational oil and gas companies in Nigeria are, however, worried that majority of the oil and gas companies operating in the country have not shown enough commitment to the energy transition journey.
We thought that we needed to organize the People's AGM to send a strong message to the investors who are meeting tomorrow that shale activity in Nigeria is causing atrocity. You can see the bad waters that the people are drinking that we brought to shale. You can also see that the environment has been destroyed completely. Women and children have no means of livelihood. The environment is damaged because of glass flaring. And shale is part of the people who caused this thing.
Nigeria is yet to wake up on the issue of just clean energy transition. But you see now Nigeria will soon launch what they call National Development Plan. And if you are privy to know what is in that plan, there is nothing like clean energy transition. And the world is moving towards clean energy.
Environmental degradation by oil and gas companies to host communities in the Niger Delta, lack of infrastructure support, among others, is central in the agitation of the protesters who called for a comprehensive national development plan that includes a mandate on the oil and gas companies to have an energy transition master plan for Nigeria.
We are also talking that Shell and other oil companies should invest more in energy, renewable energy, because that is the future. And that is the best way to preserve the environment, because the current fossil fuel is not doing any good to us. And we are also encouraging Shell company to move away from fossil fuel to renewable energy.
The aggrieved civil activist said the protest for oil and gas companies to operate within the boundaries of the Paris Climate Change Agreement will be a continuous exercise until there is enough evidence to show that the companies are committed to renewable energy in the coming years.
And to the service of humanity, Island Cardio Shinuga District Governor Lands Clubs International, the 442 to Nigeria 2021-2022 last this year, on behalf of Lagos Apex Lands Club, hereby commission this block of classroom for the use, block of toilets for the use of Wasimi Onigongo primary school to the glory of God and service of humanity.
Amen. Lionism, we serve. Lagos
Service to humanity, hereby commission this water project for the benefit of members of Wasimi Nursery and Primary School. Was powered by Lagos Apex Lions Club. Lagos Apex.
Plant a tree and protect your environment. Protect your environment. We serve better. Our way of life.
The donation of a newly built 4-room toilet block, the water project and planting of trees to preserve the environment, the Lagos Apex Lions Club has indeed made an indelible impact on Wasimi community in Maryland and Onigbongbo Community Primary School, Lagos.
I want to appreciate the God of God, the love of God, and the Almighty God, that all these things happen today, especially for our amiable, honorable Dr. Bisi Buhari. We thank you for all what you have done. God will enrich your pocket in Jesus' name. You are the best mommy in the world. We are supposed to affect our immediate community, and that's why we're investing. And our needs assessment is what has brought this project to light. When we came in here, we had a focus on something else. Let's paint the walls, let's paint the school. But the headmistress on that day, the first thing she told me was, we need toilets. I didn't agree with her. I was looking at the classroom until I saw some things. I saw the children coming out, and she explained the reason why they needed the toilet. In the end, I agreed with her because it was obvious that the children needed this toilet. The children in the nursery. And if you are in community service, you know that when you're doing something for a community, it's what they need. What they will appreciate first is what you do. And that is what has brought about the toilet. Even though when we started, our initial estimate was surpassed because the price of building materials shot up. But we thank God because he saw there was something for service to make life easy for these children, and God provided. And we're just appreciating God that every time we have the opportunity to put a smile on the faces of people. That is what Lions Club is all about.
It is very, very impactful, and I'm very happy about this. Because in Lionism, we try to identify what community needs before we actually offer this service. So it is what they need. Like the president of the club said, they came into this institution with a different mindset of a different project they want to do. But after interacting with the authorities of this school, they discovered that this is what they needed most. 41 days to go. In these 41 days, I'll be commissioning a series of projects. From Ayobo, we have another block of 10 toilets there in the community there. We have another one coming up at Ifako very soon. We have all over the place at Eden in Osun State, at Ekiti, at every project, different kind of projects, from block of classrooms to giving water to the community, to to carrying out cataract surgeries, to carrying out diabetes screening among members of the public. These are the things we do. And that is why we say it is our way of life to be touching lives of communities positively.
I'm very happy because I'm an environmentalist, and every project that Lagos Apex has carried out is all about the environment. You can see we planted trees as well, and you plant a tree, you protect the environment. We have done sanitation, providing water. Water is life. When you provide water, water is life. So the students will now go into this wonderful, clean, 5-star standard toilets. They come out, they wash their hands, and they can see the trees that will nurture them and refresh them. I actually feel refreshed, and I say congratulations to the president of Lagos Apex Lions Club. And of course, the zone chair of that club, Zone 3C, Lion Hariuka, I also congratulate you. I congratulate all the members of Lagos Apex Lions Club, and they are making me to feel so proud, because when this club was being chartered in 2012, never did we know that we will be one of the A clubs. We are one of the A clubs in the district 404B2. We are grateful to God.
For what they have done today, this is not the first of its kind that they will be doing in some of our schools, as this has been one of their intervention in this area, as you have heard. So we are glad to see this, and we are yearning for more. We need more of this.
Committed to serving humanity as a way of life and passionate about health care as one of his focus areas for Lions Club International, the occasion provided an opportunity for speakers to admonish Nigerians about scaling up their health standards and hygiene to prevent disease outbreak, like the COVID-19 pandemic still ravaging some countries across the globe.
In the next 10 years, we'll still be talking about COVID-19. We did not meet Shokmono. You know what Shokmono is? Measles. But we are still talking of measles today, because measles would have caused a lot of havoc in those days, and people are still mitigating measles. So we will still continue to work to mitigate COVID-19 havoc. So I would just want us to step up all our hygiene protocols.
Since the inception of Lion Dr. Matilda Braimo as president of Lagos Apex Lions Club, it has been from one project to another, covering all the 5 focus areas of Lions Club International to improve human lives. The 2022 World Family Doctors Day for members in Lagos State was indeed a very unique occasion, as it provided an opportunity for members to come together since the last national conference. With the theme, Family Doctors Always There to Care, the state chairman and other members spoke extensively about the role of family doctors, their challenges in Nigeria, and the need for more support.
The 3 pillars are always, there, and care. Always. Family doctors are present at all times, and continuity is a fundamental part of their work. Continuity is present in follow-ups, coordinating care with other professionals, and in research, learning new skills and technologies for professional development. The family physician is there wherever and whenever his services are needed, in war and in peace times, including during health crises, like the epidemics and the coronavirus that we just came out of. They are part of the communities they work with. Proactively reaching and engaging members, sharing their core values, creating unique connections with their parents, with their patients, and building a bond of trust. The family physician, as a caregiver, has the privilege and responsibility of delivering accessible, equitable, sustainable, and high-quality care to his patients. He identifies the patient's needs and ensures their fundamental right to health.
More family physicians, they concentrate in the urban area rather than rural area. And for us to be able to achieve universal health coverage, family physicians should actually be well motivated. They should be motivated so that some family physicians can actually go to settle in the rural area and handling a lot of cases that a lot of people will have a lot of the time. So that is one of the challenges. Our remuneration is poor. Then a lot of family members want to concentrate in the urban area. Another thing is that in terms of the training center are still limited. You can imagine Lagos of over 20 million, we have barely less than 10 training centers.
The burden of bronchial asthma was also a concern to the physicians who carried out a medical outreach at Oremeji Street Computer Village, Ikeja, Lagos.
Bronchial asthma should not really kill people, but we still see people dying from bronchial asthma in our society, often due to ignorance. Many people think it's something they should maybe take agbo, native medication on, or somebody is doing them, or arrows are flying at them. But bronchial asthma can actually be managed. People shouldn't die from bronchial asthma.
People have a very poor healthcare seeking behavior. Some people still have this impression that why should I even go to the hospital to do anything? And it's unfortunate, really, because if you don't check, you may not know. Something like hypertension, which is known as, referred to as silent killer. If you don't check, you wouldn't know whether you have it or not. It may not come with any symptom at all. That doesn't make you free. Diabetes, some people may just explain it out that, look, I like drinking water. That's why I'm urinating so much. They try to explain it out, and if you don't check, you won't know. That is why we are taking this into them.
You must know your blood pressure. I mean, of course, I know our blood pressure. Check it from time to time. Get to a nurse to even check. Get to a doctor to even check. All right? Do some screening of different important areas of the body. Cancer is curable if you find it early. Do we check for this? Do we do PSA for prostate cancer? Do we do pap smear for cervical cancer? Do we do even breast exam, both breast examination by ourselves, by a doctor, and mammogram for those up to 40 years, so we can detect these cancers early, and if we find it, there can be a cure. This is awareness we are carrying along.
Usually for every business operators, we are always very busy. Going to hospital to waste time, we say time is money. People doesn't have that time to go to hospital to go and check their medical status. But with the situation in the country now, this is a great opportunity for us that team of doctors can come around us and come and do the checkup for us for free, and even give us a drug for free. We do appreciate the family doctors in Nigeria that they count us worthy, to be attended to as one of the great citizens contributing to the GDP of Nigeria, to the economy of Nigeria, and that's why they are here.
World Family Doctors Day is celebrated on the 19th of May every year to highlight the role and contributions of family doctors to healthcare systems around the world.
Hypertension is a great burden. In Nigeria, for instance, and in most parts of the world, it is the most prevalent non-communicable disease, and it is responsible for so many deaths globally. Over 1 billion individuals all over the world are hypertensive, and it is predicted by 2025, this figure will rise to 1.5 billion. It's also been found that there's a low level of awareness. Not up to 50% of individuals all over the world who are hypertensive are aware that they're hypertensive. In low and middle income countries like ours here, this is even much lower than 40%.
Hypertension is a condition that occurs when the force of the blood against the artery gets too high. In Nigeria, more than 1.5 million cases of hypertension are recorded annually, exposing affected persons to stroke and other cardiovascular diseases.
When the heart, which is the biggest blood vessel in the body, contracts, it generates a form of tension. And that tension at the highest level strikes the wall. It is when that's contraction, at the peak of contraction, that tension on the wall, when it is measured, is what is called the highest blood pressure level. And that is referred to as the systolic blood pressure. After contraction, the heart then relaxes again. At the lowest level of relaxation as an elastic vessel, if you measure the blood pressure, that is what is regarded as the lower blood pressure, which is called as diastolic. So when doctors measure the blood pressure, we cannot directly go to the heart to measure it. we measure it at all the other blood vessels in the body, because all the other blood vessels are they emanated, they are distributed all over the body. So when you measure it at the arm, you measure two figures. The highest level systolic and the lowest level diastolic. And that is why it is recorded as blood pressure, both the systolic and the diastolic. But let me also add now that it is not only the doctors that measure the blood pressure, healthcare professionals measure it, all individuals also can measure their own blood pressure. Ideally, I expect it to be 120/80. The blood pressure tends to increase with age. And when it increases with age, as of definition of today, we accept that we would like your blood pressure to be lower than 120 or to be lower than 120/80 as the ideal blood pressure. But this is not what you find all over, especially with people who have developed high blood pressure. You want your blood pressure to be lower and to be close to lower than 140/90, and the closer you are to 130/80 or to 120/80, the better we are. The more you age, the more your blood pressure increases.
Blood is a medium through which essential nutrients and oxygen are taken to various parts of the human body to enable the bodies and the tissues to function normally. The blood pressure results from the pump action of the heart, and this pump action generates pressure. The blood pressure is normally from 120/80. It could be higher in some individuals. Usually when it is more than 140/90, the way it is recorded, you will say that the individual has hypertension or has high blood pressure. And the individual will need to be seen by a doctor or a health worker who is trained in that area to know exactly what to do. Hypertension is when the blood pressure of an individual is 140/90 or higher than that. When the blood pressure is recorded in an appropriate way and found to be at this level, it needs a doctor or a specialized health personnel who is trained in area of hypertension measurement and the management. This individual is expected to be investigated and given appropriate medication. When the blood pressure is not lower to appropriate levels, it causes a lot of problems. It can affect the heart, it can affect the kidneys, it can affect the brain, it can affect the eyes. And it is important to have it reduced to normal levels as soon as possible. Over 90% of people who have hypertension, the cause cannot easily be found out, and these are majorly genetic, run in families. From 5 to 10% of individuals, some known cause can be found out.
The 2022 World Hypertension Day theme, Measure Your Blood Pressure Accurately, Control It and Live Longer, provided another opportunity for experts to throw more light on preventive measures.
It is not everybody that ages develop high blood pressure. And diet is central to hypertension. When we talk of diet, number one ingredient we talk of the diet is salt. Salt, the more salt you take, the more tendencies for you to have hypertension. And as scientists, we recommend that you should take salt less than 5 grams daily in your diet, in your food. Or you should not add salt to when you prepare your food. There are some ingredients that are laden with salt, especially those ingredients that are available in the kitchen. You should not add them to food. A lot of them are laden with salt. So if you want to avoid salt, there are certain vegetables you can take that can also give you the same amount of taste for your mouth. So try to avoid salt as much as possible. Then we also talk within the diet, we talk about too much fat in the food is also bad. in terms of when you are talking of diet, because that also can affect the arterial wall, the walls of the arteries. It can make them more thickened and can make also more thickened to hypertension. We talk of physical activity, sedentary activities. Do not sit for a long period. Try to exercise. And we say exercise, which is physical activity. When you do physical activity like this, we recommend for an adult at least 150 minutes per week. If you can do exercise of 150 minutes per week, like 30 minutes every other day, depending on whatever you do, if you walk, if you jog, if you swim, that's a form of physical activity. So that is also very good for you. Then we talk of alcohol. Alcohol consumption also affects the amount of content, your blood pressure. We talk of smoking of cigarette. Also, we talk of diabetes. There are certain conditions like diabetes is very close to hypertension. Try to look at your sugar content. It's not too excess. The more excess sugar you have, the more tendency you have hypertension, and the more likelihood of your blood pressure going up.
Measure your blood pressure accurately, control it, and live longer. It's been found that a good number of people do not even measure their blood pressure, and when they do, some don't measure it accurately with recommended machines for recording the blood pressure, and by those who are trained to be able to. The automated blood pressure machines that are coming out now, the good ones, they record and they give you the figures. The figures do not depend on individuals reading it and interpreting it the way they want. So you need to measure the blood pressure accurately. And then, of course, seek the services of a health care personnel that is trained, a doctor or any other that is trained in that area.
World Hypertension Day is marked 17th of May every year to raise awareness about the disease.
Present you this also on behalf of the Air Force community, some economic foundation. Present you this message also as part of our medical outreach this morning.
The Nigerian Air Force says it will continue to prioritize the provision of access to healthcare delivery and other humanitarian services for security operatives, internally displaced persons, and host communities. Air Officer Commanding Logistics, Air Vice Marshal Abubakar, disclosed this in Lagos while flagging off the medical outreach organized by the command in collaboration with the 661 Nigerian Air Force Hospital for residents.
Now, the aim of the outreach is just for us to be able to give back to the community, to enhance our civil-military relations, and also to get back to those members of the community who ordinarily are not strong enough financially to be able to access medical services. Just like a normal hospital, you take your vital signs, you go through consultation, you go through prescription, and then if there is need for you to be referred and something that cannot be done here, you'll be referred to our facility on the base, which is very comprehensive, and then the treatment will continue.
The medical outreach was part of activities to mark the Nigerian Air Force 58th anniversary. Residents were screened and treated for ailments like HIV/AIDS, dental caries, and blood pressure checks.
When we're in the military, without health, we cannot function. So we take health as a priority. It's the best gift you can give anybody. Once you're healthy, you can engage in any of your, you can engage in anything you wish to engage in, and you do well.
Benefits better thing here, and we like this. I collect glass and some rugs.
Practitioner and childcare expert Hanato Ewemalu and other stakeholders here, the boy child is fast becoming invisible, hurried through childhood into adulthood, and thought to mask their pains as their tears must not be seen.
Domesticate the boy child. Let him understand, express his feelings, his emotions. Don't hurry them through childhood. Please, it's very important. Let them grow at the pace they ought to grow.
There should be a lot of collaboration between mothers and fathers in the bringing up of their children. I think the trust that the teachers in schools had before should be restored.
Stakeholders also noted what they termed a subtle bias that puts most dispute resolution in favor of the girl child, thereby encouraging the abusive instinct in most boys against girls.
The support it gives to the child will always stick to the child wherever I go and wherever I may be in life.
You have to wake up and be intentional about children. You say, I didn't have much, my child will not suffer. What you didn't have made you who you are today. Give them adversity. It's part of life. Don't lie to them. Tell them all of life is all rosy. That's not how life is. There will be seed time. There will be harvest. There will be rain. There will be sun. Allow these children grow organically. Sun-ripened fruits are sweet. When they are forced to be ripe, they look ripe, but taste them. They are bitter. They are toxic, dysfunctional. These same boys who are dysfunctional will go up to corporate organizations and be crazy and manipulate and hijack. So we have to trace the root cause of all this madness. It's back in the home.
We at National Initiative therefore call upon all sundry teachers, caregivers, civil society and organizations, all levels of government and other stakeholders in this Nigerian and African space to lend a voice against the unfair balance and growing neglect of the boy child, and to create more platforms and resources that will promote the interest and the total well-being of the boy child and salvage their fast winning posture and position in society.
International Day of the Boy Child is celebrated 11th of May every year to focus global attention on the well-being of the boy child, their need to feel happy, healthy and valued within the family and community.
We asked the boy child at all levels to send in their essay entitled The Father and the Son Relationship from the lens of the boy child based on their relationship with their father. They will be announcing the winners of this essay competition, and come June 19th, during the Mother's Love Initiative Community Fatherhood Ceremony, which happens to be on Father's Day, we'll be giving prizes to all that come out tops.
Customer, here are the tomatoes. What else shall I give you?
Add pepper and Auntie, this your cough is getting out of hand now.
Take it easy with her now. But customer, this your cough. You should go to the hospital.
You know I can't go there with this cough at this time. They'll just say I have COVID-19.
Customer, every cough is different. It could be tuberculosis.
It's true, Auntie. Check am, make you dey sure.
Because who no go?
No go, no.
Check that cough for tuberculosis.
Check am, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
Access to good and nutritious food is vital to human survival. But as important as food is to humans, it can also be a source of disease transmission if not properly handled. This is evident in a recent WHO report which says that over 600 million people die annually across the globe due to foodborne-related diseases. Listen to a cross-section of researchers at a recent event in Lagos State on how to prevent foodborne diseases.
Major causes of death in Africa, West Africa, or even Nigeria are due to diseases. So we need to begin to synergize on what we can do to address causes of diseases. You will see that the food is a very important aspect of causes of diseases. And then we must be very careful of what we eat, what we drink, and what we even smoke in some cases. It's a joint responsibility. Research institutes have responsibilities in conducting research. The food regulators, like NAFDAC, they have responsibility in looking at the quality of food. that are consumed by the public.
Everybody eats every day. All of us, we eat every day. If we're doing food right, it means we're doing something right every day. If we're doing food wrong, it means we're taking a risk every day. So good food saves life. Access to safe and nutritious food is key to sustaining life and promoting good health. Furthermore, the entire world today is concerned with biosecurity and the safety of human population. An integral part of biosecurity is the safety of our food supplies and the health of those of us who consume that food. Food safety, which is our focus today, is the handling, preparation, and storage of food and drink supplies in a way that best reduces the risk of consumers becoming sick or infected with foodborne diseases or dying from these foodborne diseases. And the spectrum of diseases that we can get from food is quite wide. It goes from viruses to other organisms like Campylobacter, Salmonella typhi, and the non-typhi organisms, E. coli, both enteropathogenic E. coli and enterotoxigenic E. coli, Vibrio cholera, and so many other things that we can contact or contract from eating contaminated food. So this is serious business. That's a lot. That's significant. It's something we should be discussing every day. This research project that we are flagging off today on health advocacy for food handlers and consumers is especially important in a mega city like Lagos State with a heterogeneous population of more than 22 million people who are constantly on the move. As the DJ said, we're always rushing from one place to another. And so we buy what we find and we eat what we find, and that can be dangerous if the food is not of the right quality. An outbreak of disease, of foodborne disease, in a city of 22 million people has security implications, not only for Nigeria as a country, but even for the West African sub-region. We've seen with Ebola what can happen as we cross countries within the West African sub-region.
There are some basic principles of food safety. The aim is to actually prevent food from being contaminated or causing food poisoning. And what are the things that we need to do? Number one is to properly clean and sanitize all surfaces. So if you are working in an eatery, the first thing to do is to clean, sanitize all surfaces where the food is being prepared and all the equipment and utensils. Second would be to maintain a high level of personal hygiene, especially hand washing. Thirdly, there's a need to store and eat food correctly with regard to temperature, environment, and equipment. And this is because bacterial pathogens kind of grow in different temperatures. So temperature is very important with regards to food. Then again, implementing effective pest control, especially in places where food is being prepared, and understanding the aspect of food allergies, food poisoning, and food intolerance. There are many hazards that you can be exposed to when we talk about food. It's not just only microbial issues, which is the main thing we are talking about today. There are other things like physical hazard. There could be issues you have some strange objects in the food that someone could consume. I'm sure you must have heard people who inadvertently swallow pin in food and got stuck in their throat. So you can have metal, wood, glass, plastic in food we consume. And there could be chemical hazards, especially in places where food is being produced. Things like caustic soda, detergent, pesticide could cause some challenges. But the major one we are talking about today is the microbial issues. And I'll just say one or two words about bacterial food poisoning. We know bacteria are mostly single-cell living organisms, and most of them form or can cause food poisoning. And why? Because they survive in different environments like water, food, needing correct adequate temperature and time, and also access to oxygen. And it is said that under some conditions, some bacteria could multiply, divided by 2 in every 10 to 20 minutes. And one bacterium can multiply to over 260,000 within a very short time. And this is why we have issues with food poisoning. Occasionally, you can start with cheese and rigor, and some rare cases require paralysis. And many germs causes food-borne illnesses. We have something like Salmonella typhi. Many of us are familiar with typhoid. By the way, most of the typhoid being diagnosed out there is not really typhoid, all right? But the real typhoid we know, all right? So typhoid fever, there's one called Clostridium perfringens, Campylobacter species, all those big names, they are all bacteria and viruses that will cause this. Norovirus, Staph aureus, Listeria monocytogenes, and Shigella species. So in Ethiopia, they actually took 2 samples from food handlers and they tested it. And they saw that 3.6% of them has Salmonella. That is the obviously causing typhoid fever. So food handlers actually have some organisms that is inside them, and I will explain this to us with a practical example as I move forward. Now, you talk about the thing that causes transmission of germ from feces, to another person. And what are the things that will cause it? The first F is the feces itself. All right? The second F is the finger. So if the hand is not washed, I use it to touch that thing, it can help in transmission. The next one is flies. Housefly, they are mechanical vectors. What they do is to carry germ from the feces and take it to the food that is being consumed. Then the next F is food itself. And the last one is the face, or the one consuming the food. And there's 3 other Fs: the water we drink, fluid, the field where we grow vegetables. That's why it is not right for you to buy vegetable and begin to eat it without first washing it, because it can be contaminated at the soil where it is planted. And of course, flood water. I was privileged to be part of a team that monitored cholera outbreak in Nigeria from 2010 to 2013. And what we saw is most of the places where there was cholera epidemic, there was usually heavy rainfall, and you have rainwater washing pieces into the streams that people drink, or through into a shallow well that people drink. I want to share with us the story of a woman called Mary Mallon. Mary Mallon was a cook who lived in New York City in 18th century. She was born in 1869. She eventually died some couple of years later, around 1938 or thereabout. She was what we call a headache carrier of Salmonella typhi. That is the germ causing typhoid. And it was noticed at the time that they saw people developing typhoid in 7 out of the 8 houses where she has cooked. She's like a personal chef who cook at different places. And the last place she worked where this became known was a small shop owned by, a small apartment building owned by a certain man who has apartment building. And the man was worried that why are people in this place coming down with typhoid? So he employed the service of an engineer who have interest in epidemiology. Remember, this was in the 18th century, so we don't have many doctors there. And the engineer was able to triangulate to find out that the cause of this infection is likely to be this woman, because everywhere she has worked, they have issues with people coming down with typhoid, and some of them dying. So, when they took, after a long time, they were able to convince that she was resisting arrest, but the engineer went to the New York City Department of Health and they arrested her and collected 2 samples from her. And they found out that she has high concentration of typhoid germs in her stool. And they stopped her from cooking for some time. She was quarantined for about a year. Later on, she was able to go to court, secure her release, and she went underground. Went to another place, also began to cook again. When she died, and they did autopsy for her. They saw salmonella typhi in her gallbladder. So for a very long time, she never fell sick, but she was transmitting these illnesses. That is why around the beginning of 19th century, she was called Typhoid Mary. So it is possible for someone to transmit germs without knowing it, and you are healthy. We call it healthy carrier. So this is the single most important reason why we need to screen food handlers, even for yourself, so that you know that you are not transmitting, and you cook for your family, for your children, for people around, not just people that are coming to buy food from you. So it is very, very possible to be spreading germs across without you knowing that you are carrying germs. So preventing food poisoning, what we need to ensure is clean hands and clothing. So the cloth that you are wearing when you are cooking is as important as your hand. So we need to be ensure that we clean our hand regularly. I'm going to tell us more about that. And also wear clothing. You should have an apron that you wear so that you don't spread germ. Number 2, minimize jewelries on hands and wrists. It is not responsible to be cooking with long finger nails or painted nails, because germ can hide under those nails. Then, if you have long hair, tie your hair back or use scarf, because germ can spread from your hair if it is dangling to the food you are cooking. Number 4, clean. I've already mentioned that. Cut your finger. Number 5, avoid unnecessary contact with food. 6, cover all cuts and sores with bright color waterproof dressing. So you need to cover any wounds. It happened during Easter. I was helping madam to cut chicken, and before I know what's happening, I've already cut my finger. So it can happen. So what you need to do is to get a plaster, quickly cover that hand so that you don't spread germs to the food you are trying to cook. Do not eat or do not overcook food. Do not prepare food when you are healed. I know we are trying to make money, but when you are not up to it, when you are sick, you are coughing, you have catarrh, please stay away. Don't cook at that period. Avoid touching your face and your hair when you are cooking. Do not cough or sneeze to the food. Do not taste with your finger. Use like a spoon so that you don't introduce germ when you are trying to taste the food, and many more. And I want to talk about the issue of washing hands, because it's about the single most important thing that every food handlers must do. So when do we wash our hands? Number 1, before you start cooking, and before you touch any food. And may I just mention here that don't keep cooked food and raw food together. But when you do that, germs can transfer from one to the other. So again, when you wash your hand, you should wash your hand after you must have prepared raw food, especially after you must have visited the restroom. You should clean and sanitize the environment regularly. You should wear gloves, okay, when you are preparing some food. I'm sure if you watch Food Network, I do that my pastime. There's some food when they are mixing meat together, they always wear gloves. But I'm not sure.
If you are just joining us, it's Health Affair on AIT. Next on the program is a nutrition segment. It is an aspect of the show where we'll give you information about food, fruits, and their nutritional value to enable you make healthy choices. African walnuts are fruits of a woody perennial climber plants found mostly in the dense rainforest of Africa. It comes in a hard kernel casing, which releases a whitish round nut when cracked open. The shell color ranges from black to any shade of brown. The fruit has a firm and crunchy texture, with mild flavor when cooked, but upon drinking water after consumption, it gives a bitter taste sensation attributed to the presence of some variants of chemical alkaloids and phytochemicals which has no toxicity and of no danger to humans. African walnut has a long history as food plants. Its economic importance lies in the edibility of its oil-rich endosperm, which is consumed by diverse populations in Nigeria, Sierra Leone, and the Lower Congo region. Although it is believed to have originated in southwest Nigeria, where it is usually cultivated by subsistence farmers, in the hot and humid zones of tropical Africa, in compound gardens and backyards, just for family and local market consumption. Today, it is widely cultivated from Sierra Leone to Angola and in the Democratic Republic of Congo, Nigeria, India, Cameroon, Gabon, and Niger. Every part of the African walnut tree is used in both raw and finished states. Its timber and nuts are used to produce medicine for kidney problems. The wood is used to make pilings for bridges and railway ties. The fruit is cooked with its shell at a boiling point temperature, above the boiling point of water, and left for up to 10 minutes on fire. It is served with its shell, which must be removed before eating. In a similar way, it can be baked in the oven by placing raw nuts on a pan and put in an oven for 15 to 20 minutes. They can as well be served roasted as healthy snacks. African walnuts are seasoned fruits with enormous nutrition and health benefits. These nutritional contents in walnut provide immense benefits to the human body in several ways. The nutrients include antioxidants, minerals, vitamins, and some plant compounds that the body requires daily for overall maintenance and development. A 100-gram serving of shelled walnut contains or supplies 350 kilocalories of energy, 13.14 grams of carbohydrates, 24.0 grams of protein, 12.39 grams of fats, vitamin C, vitamin E, vitamin B6, B7, and thiamine, minerals, calcium, potassium, magnesium, zinc, and sodium, omega-3 and 6. African walnuts help to prevent some mineral and vitamin deficiency. Eating this fruit helps also to protect you from certain chronic diseases. Come with me to our clinical segment for tips on healthy living.
You know, it is always said that our health is in our hands. And if we take it literally, you see that these our hands can do quite a lot of things. But when you also look at it in terms of bacteria, you see that it traps a lot of bacteria. So, as much as possible, it's important that we wash our hands. All of us, everybody now understands that we need to wash our hands. But you see that there are different ways people wash their hands. If you wash your hand well, then you'll be handling this issue of taking out bacteria from your hand, and it will not enter your mouth or your eyes or other open places in your body. So now I'm going to demonstrate hand washing. But first of all, let me show you what some people do. They will just do things like this. They have washed hand. That is social hand washing. Sometimes people just do things like this. They have washed their hands, but then they have not completely washed their hands. So we need to give a little attention to the way we wash our hands so that it will benefit us. First of all, you try to wet your hand just to put some water, then you take the soap. When you take the soap, you put palm to palm and you rub that soap. You can even do it 5 times. Just 1, 2, 3, 4, 5. Then you do it 1, 2, 3, 4. This under 1 minute, you have finished doing this. Then you make sure that all these places that trap bacteria, they are taken care of in between your hands and the back of your hands. You see that sometimes, even all these ones, you see there's not much water because water has not touched this back of it. So when you're watching, you pay attention to it. So 1, 2, 3, 4, 5. Then you do this 5, 4, 5. Then you wash. These are places where bacteria trap. Then you wash the tip of the fingers. And ensure that every other thing that traps, then you rinse off. You can leave it to air dry, or you use a disposable if you have to clean your hand, and that is it. Your hand is clean. What doing is really what doing well. And you see, this does not take us up to 20 seconds. I've finished.
On our perception segment, we value your opinion on how to improve human lives and the nation's critical infrastructure.
You rush your loved one to the hospital for emergency, the way they will ignore you, the way they will talk to you, even the worst part of it, if you don't have money, just expect that person dead.
One passenger, big auntie. Come and enter my bus now.
Hey, conductor, this cough is serious. Abeg, you need to go to the hospital.
Hospital? Auntie, if I go hospital now with this cough, those people will just say I have COVID-19.
No, they won't. Doctors say cough symptoms are different in every condition. Some are dry, others are wet, like your own.
God bless you, auntie. I have told this my conductor. The cough has refused to go, and it could be tuberculosis.
Conductor, check am o. Make you dey sure, because who no go, no go, no.
Check that cough for tuberculosis.
Check am o, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB test and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
This will wrap up the show today. Thanks for spending your time with us. Please, let's do it again same time next week. My name is Ushuomowa Daniels.